Welcome to another Thursday Live. I'm Dr. Jerry Dreessen with the Association of PEMF Professionals, and I want to welcome each and every one of you that are watching today's broadcast live, and of course those of you that are watching the recording. Thank you very much for taking some time today. And our whole purpose today is to tackle as far as the metabolic reset that we've got going on, and as far as inflammatory and what's going on in our world. So how the inflammation code calms the body's overactive signals. And so what we want to do is jump right into that. And what we're going to want to do is uncover how PEMF interacts with the inflammation at the cellular level, supporting the body's ability to restore balance and recover naturally. So the core driver, in fact, let me just change this and get me over there. There we go. As far as the core driver of pain, fatigue, and slow healing. So we have a protective system, but it can be destructive when it's been prolonged. And in fact, our immune system, those of you that know a lot of inflammatory reactions, are the immune system not recognizing our bodies and thinking that our cells are the enemies. And so it begins attacking that. And that's like with gout and rheumatoid arthritis, things like that. So inflammation is the body's alarm system. And in short term, it triggers healing, but long term, it damages tissues and also drains energy. Because if it's a system that's constantly on, it needs energy to do that. So where does it take it from? It takes it from your energy sources. It steals it from your batteries. Understanding how PEMF modulates this process gives practitioners clear science-backed framework for supporting recovery. Now, as far as the inflammation, friend or foe, again, acute is the repair signal. Chronic is that it's stuck on. And that's, chronic fatigue syndrome. You've heard that before. And people who have allergies, they're totally wiped out, those kinds of things. So in acute inflammation, you've got swelling, you've got warmth, you've got redness, you got a signal blood flow and immune activity. So your white blood cells will spike, basophils, eosinophils, you've got all these different types of cellular growth based on what's happening. And in chronic, the signals never turn off. So hey, we won, there's no finish, there's no checkered flag at the finish line that goes off. And so your system continues to stay on. Well, where PEMF enters this cycle is you've got the cell stress, the ion shift, the inflammation. PEMF restores that charge, and then there's a resolution. So PEMF is a way of getting in there and helping your cells do a pause, and it's almost like a reset in a way. So PEMF restores the normal ion exchange and membrane potential, calming overactive inflammatory signaling. And then when cells regain their electrical balance, they can communicate efficiently again and allowing inflammation to resolve instead of persist. So it's a great way of getting your body to recognize that it's unlike the tide keeps going out or coming in, and this is a way of resetting that. So those of you that want to geek out in the science, we've got this pro-inflammatory cytokines that go off. Nitric oxide and vasodilation increase, the oxidative stress markers decrease, and then there's improved microcirculation. So cellular and animal studies show PEMF can reduce inflammatory cytokines. They enhance the nitric oxide production for better blood flow. Those of you that are that have watched our previous Thursday lives know we've gone into that a little bit more. And then also decrease oxidative stress. So together, these mechanisms help tissues recover faster and function more efficiently. Again, if the the body can't recognize what it's doing, then it can't modulate itself the way it needs to. That's one of the things that a chronic illness can do, or chronic inflammation can do. So as far as the inflammatory timeline, there's an onset, phase 2 is regulation, and phase 3 resolution. So that can take hours, it can take days, weeks, months. Is it a broken bone? Is it a surgery with stitches? What is going on in that system? Is it internal? So do you have irritable bowel syndrome? Do you have some sort of internal organ inflammatory response? Is your pancreas inflamed? Is your liver inflamed? So PEMF is most beneficial during the regulation and resolution phases, and it supports circulation, calms the cytokine activity, and then also reduces edema. And it also complements the body's natural progression rather than overriding it. Clinical and veterinary applications. So you have soft tissue injuries and joint pain, post-surgical recovery, inflammatory skin conditions, and then the equine laminitis and Cushing's support. So there's, as you know, there is the skin, there's the soft tissue that's inside there, which is the muscles, the ligaments, and fascia. And then you've got the bone and bone marrow. So those are all the different levels. In practice, PEMF is used to manage the consequences of inflammation, as far as the stiffness, swelling, and discomfort. Consistent sessions can help restore mobility, accelerate tissue normalizations in both people and animals. And one of the things that we're really big on is the body, when it detoxifies after this. That's probably one of the biggest moments that you have to help your clients out, and that's the increase the amount of fluid so that this detox can happen. Otherwise, the longer they're in that detox, the more painful it can be too. So that's another big one. But the language that builds trust, it supports healthy inflammatory balance. It encourages natural healing responses. So again, PEMF doesn't heal. PEMF allows the cellular structure to heal. So the body's natural ability to heal is enhanced with using PEMF. And again, promotes circulation and comfort. Avoiding words like treats, cures, eliminates inflammation. The body does all the work. If you think of it this way, the body does all the work. PEMF is one of the things that helps the body do that better, faster, stronger. So using compliant, wellness-oriented language, again, protects both you and your clients. You focus on what PEMF supports, the body's own process, not what it fixes. So credibility grows through clarity and integrity. So I always look at the body. The body knows what to do innately. It can be confused or blocked or cut off from what it needs to do. And if you can enhance the body's ability to do what it needs to do, then that's where true health comes from. Integrative strategies is to combine with movement or stretching to prevent stiffness. Those of you that are part of our certification program know all about the different types of therapies that go with using PEMF, from static to dynamic. And then also pair with nutrition and hydration for cellular repair. So if you want to rebuild a brick house and you've got the energy to rebuild, where are the bricks? And that's part of the nutritional side. What is it that the body needs? What can you feed the body to help it go through that process better? And then complement massage, red light, chiropractic care, the modalities that help the body line back up, become more efficient. Those are all of the things to think about too. So, and again, massage therapists, people that do red light, chiropractors, those are power partners. If you can align yourself with those healthcare providers, that would be great. Inflammation reduction is multifactorial, and PEMF enhances outcomes when paired with proper movement, hydration, nutrition, just kind of re-emphasizing the last couple of slides. It integrates seamlessly with other therapeutic modalities that also target circulation and target recovery. Ongoing evidence and research. So emerging studies on how PEMF's role is there in wound healing, edema control, post-operative recovery, and arthritic joint inflammation, and also neural and microglial regulation. And Barbara, hi Barbara. Yeah, power partners. And those of you that do any networking, if you can align yourself up with people that are in similar fields, but you refer back and forth to each other, that's a great power partner, just like a mortgage advisor and a real estate agent. Those are really good power partners. And if they can align themselves with somebody that does reverse mortgage, or helps the elderly, that group, they can all inter-refer and help each other out. So find your power partners with who you work with. Next, we've got professional compliance matters. So again, device neutral education. So talk about PEMF. I mean, the machines you're using are awesome and wonderful, and you can talk about those too, but also just talk about in general what PEMF does. And ethical marketing language, include a wellness disclaimer in what you're doing, and also document outcomes and responsibility. And some of the reasons of that too is, let's say that you're shopping around and you find another PEMF device that works really well, and now you have two different manufacturers. That's okay. But if you've already put all your cookies in the cookie jar of the manufacturer that you're using, when it's time to split, it's a little bit more difficult. So if you can stay neutral to that, that's good. But those of you that have great manufacturers, you're probably never going to move outside of that brand. So again, we at the AOPP, we are all devices neutral. So that's where we are. And again, stay aligned with the AOPP standards, avoid overpromising, and always clarify your scope. Documentation of client progress builds data credibility while maintaining ethical boundaries. And again, I talk about in my practice, I have a chart when somebody comes in. It's the date, the day, the settings, what their symptoms were, what's improved, if it's range of motion, if it's circumference, if it's visible, all of those things. So that as they're coming in, we can look and see that they started with 10 minutes and they're doing 20, and now they're doing 30, and what the settings are, and the range of motion before and after. Sometimes we forget those. And if you're not charting it, neither one of you will know, especially once you start seeing a bunch of different people. It's like, man, I forgot. When did you come in last? What did we do? More that you can have those things charted out. And again, you can just create a single, chart that has lines with the dates and what's done. It doesn't have to be a full page for every visit, which is what I do. So I have 22 visits on a page. So I just go across the lines and fill them out, and I have my own hieroglyphics that I use. Like the P with a line on it is for pain, and then without. So you can use your own shorthand as long as you can understand it. And then finally, as far as the summary, again, calm the signals, restore the flow. PEMF helps the body resolve inflammation by restoring cellular communication and energy flow, by supporting cellular voltage, improving circulation, and reducing oxidative stress. PEMF helps the body transition from inflammation over to repair. And it's not about suppression, it's about restoration. And that's where we get into the medical side. So we have to suppress your immune system. We have to suppress this. We have to remove this. And PEMF is a great product because, again, it helps the body do what it's designed to do. If it's weak or unable or getting a missed signal, it helps restore all of that. And the more you learn about PEMF, the more amazing you'll find out all of the great things that it does. So again, inflammation is energy trapped in the wrong place, and PEMF helps set it free. That's a really good one. Now, for those of you that are wondering, how can you learn more about PEMF? hey, in 2 weeks, is that what it is? November 5th and 6th, it's a Thursday and Friday. We have our annual PEMFCON 2025. I want to welcome every one of you to come join us because we've got some great things going on. We've got some great speakers set up talking about humans, animals, equine, small and large animals, people that use this every day. We've got the science behind it. We've got a whole bunch of different things, everything that you would want in a PEMF con. And hey, Barbara, yes, took both days off. It's a great thing to do because the other thing is after the presentation, you also get to go into a little chat room and drop in questions to that speaker and get direct answers from them as well. Those of you that can't make it, it is going to be recorded. So just know that it is happening and tickets are officially on sale. PEMFprofessionals.com/PEMF.con and .com. And on the bottom of our website is a link. But also at the very top, there's a banner now, so you can't miss it when you log in and you take a look. And like I said, I invite everybody to come, whether you are a PEMF business, if you're using PEMF, or if you are thinking about it, or you have like infrared and you think about expanding the PEMF, or you have PEMF and you're just now seeing this video and you want to learn more about it, or you're thinking about opening up a business. We have a business and you're thinking about growing it, all walks of life with PEMF. And you can also become a member. And during our convention, we're having a special membership drive and you can get some discounts there. And you'll learn more about what PEMF is all about too. But if you want to become a member, you can do so, PEMFprofessionals.com. And again, if you have any questions about us, who we are, what we're about, or speakers for the convention. It's a virtual, so it's all on Zoom. So we are sticking to that again this year. It's been the easiest. You don't have to travel. You just have to show up. But again, if you aren't able to make it, there is a recording of it available to people that register. And then some things that you can do to help us out is to spread the word. So we have things on our blog. We have Instagram, YouTube, Facebook, LinkedIn. We're on all of those places. Have a chance to go and find us on those and like and share those so it spreads us out to even more people that are looking for PEMF and how they can help their people. So with that, again, I want to thank you very much for being part of today's live. And I look forward to chatting again next week. And then, of course, then we go into our PEMFCon. So keep the faith. Get out there, do some healing. Remember, get out there and do some PEMF stuff that allows the body to heal itself. All right. Take care. We'll see you next week. Bye.